The Quezon City government opened the Baysa crematorium in March to address the rising COVID-19 deaths. Since then, it's been operating non-stop. Health protocols say anyone who died of COVID-19, confirmed or suspected, should be cremated within 24 hours to avoid spreading the virus. Among them was Jacinto de Asis. He died of pneumonia, but his family wished they knew if COVID-19 really cost him his life. He died one day before his scheduled swab test.
Magpa-test din po kami kung nag-positive yung tatay namin.
The crematorium management is seeing fewer confirmed COVID-19 deaths than before, but there's still at least one COVID-19 probable or suspected in every 8 bodies they process daily.
Usually po, ang nababasa namin sa death certificate nila, yung acute myocardial infarction o yung mga pneumonia, usually mga respiratory po, yun po ang kadalasan na sakit.
This means there could be more COVID-19 deaths than the official count. This begs the question, how does the government account for suspected and probable COVID-19 deaths? Those who were swabbed before they died and would eventually test positive will be part of the COVID-19 deaths. But health officials say there's no way to know if a person was not tested when he was alive.
Wala pa po tayong sapat na ebidensya that even in cadavers or those people who have died already, na mataas pa rin ang load ng virus.
The Health Department has yet to release the number of cases and deaths among COVID-19 probable and suspects. CNN Philippines looked at 7,039 deaths as of October 26 and found that only 45% of those who died were admitted to hospitals. Most are from Metro Manila and Calabarzon. At least 1,200 were only tested on the day they died. Dr. Tony Liachon says a patient showing symptoms should be immediately tested.
Iba pa rin when you're treated na talagang ikay positive right away. You will be given attention rather than differential diagnosis.
Okay. Ang ating mga doktor at ating mga clinicians sa ospital, once they see that the patient is exhibiting COVID-related symptoms and signs, they immediately treat the patient as COVID already.
For epidemiologist Benjamin Ko, early testing is crucial for contact tracing.
Yung mga namamatay dahil sa COVID, biglang namamatay at hindi natetest, that becomes a problem because you're not going to be able to contact trace everybody that came in contact with that patient.
Doctors say oftentimes patients are brought to them when their conditions have worsened. For Diasis, it was due to fear of hospital in the wake of the pandemic. His children had to force him to see a doctor on the 6th day of his illness. Same with the husband of Starina Martinez. They feared catching the virus at the hospital due to high transmission in Cebu City in June. Joseph was rushed to the hospital after 6 days of on and off fever. He died on the 3rd day of his confinement.
Marami po nagsasabi na, naku po kung dadalhin nyo yan sa ospital, baka imbis na walang COVID, nagkaka-COVID na.
Test results only came out after his death. He had COVID-19.
Kung nadala ko sana siya ng mas maaga sa ospital, siguro agapan pa. Or kung pipili ako ng ospital, kung marami siguro akong pera, ma'am, siguro dadalhin ko siya sa mas, yung ospital na mas may, maraming facilities talaga na pwede siyang masalba.
We make sure that we have all safety precautions in place and that you should not be afraid of going to the hospital when you are sick.
But that's not the only issue. Dr. Ko says some patients are also afraid of the stigma of being judged by neighbors or co-workers or because they can't afford to go on quarantine. Work never stops at Baysa Crematorium, and it won't slow down until there are fewer people dying from COVID-19. Caroline Bonkin, CNN Philippines.